Now, we all want to look good and feel great. Joining us today to talk about the importance of your eyelids is Dr. Jennifer Hui of the Eyelid Institute.
Hi.
Eyelid Institute, welcome. How are you?
Very good.
Good.
Thank you for having me.
Oh, I'm excited to have you. This is something I don't know much about at all.
Okay.
I know I have eyelids, that's about it.
Okay.
So you're a focus specialist, tell me a little bit about your background.
So I'm an ophthalmologist. So I did 3 years of training in ophthalmology, and then I went and did 2 additional years in fellowship for oculoplastic surgery. So that's plastic and reconstructive surgery. That's everything outside the eye. So I do eyelid disease, orbital disease, meaning fractures, tumors, any kind of inflammatory process, and tearing disorders. So I don't do things like cataract surgery or anything in the eye. No, just everything outside the eye, the periocular structures is what we call it.
Okay. What type of patients do you normally see?
So we see children all the way up to adults, people of all ages. The focus of my practice is eyelid conditions, whether it's cosmetic surgery you're looking for, any type of functional surgery. So if you were born with a congenital eyelid defect, some acquired eyelid defect, malposition, results of trauma. I do a lot of revisional work.
Oh, there we are right there. Okay.
Yeah.
So before and after. Okay.
Yeah. So I mean, for example, the first person had drooping, which comes with time at times, and beyond having extra skin, she also had drooping.
Oh, wow.
So you can see how she looks half closed, basically.
Well, yeah, she looks like she's tired. Now she looks like she's wide awake.
Yes, and the pupil is actually occluded in the first picture. So you're looking for a very natural result. At the end, I never want patients to come and tell me that somebody asked them, who did your eyelid surgery or when? I want it to be that something is just different.
And
you
natural.
Look refreshed.
Yeah.
Did you go on a nice vacation? Did you, what are you doing to take care of yourself? I never want it to be obvious.
And men too. Okay.
And especially in a man, you want it to be subtle. I mean, there's not huge differences. He just looks refreshed.
Right.
You don't want to feminize the look of a male patient. You just want to keep it nice and subtle. There's certain differences that I make and adjust for during the surgery, where I place the crease, how much skin I remove, how I close the incision. You just tailor it for each patient.
I feel like if I had not seen the before or after, you obviously wouldn't know the difference. But the before, I mean, you can really see how it sags.
Yeah, he has a lot of hooding out.
Hooding, okay, that's a good
lateral
word.
half.
I guess that is the technical word for it, right? So as far as eyelid procedures go, is this a newer procedure?
No, these are procedures that have been around, for many years.
Okay.
But the difference in our practice is that I specialize in eyelids. I don't do body work. I just concentrate just on the eyelids. The eyelids are different than the other parts of the body. It's a different anatomy. You have to recognize certain structures. Oftentimes patients will come to me and say, I just have a lot of extra skin, but in reality they have the ptosis, the drooping. And if you don't address the drooping and you just simply remove skin, they will have less skin, but they will still look tired following procedure, and they just will think that something's not quite right, but they can't put their finger on it. So you have to address underlying conditions and make sure that you address everything.
Tell me about eyelid cancers.
So that's another big part of my practice. People don't often think that they can get a cancer on their eyelid, but it's very common, especially in where we live. It's most common in the lower lid.
Okay.
The second most common place is in the medial canthus, so in the inner corner. And some people will just think they have a pimple or a cyst or a sty perhaps and just ignore it. But the things to be concerned about is that if your eyelashes look distorted, you have some crusting or bleeding, it just doesn't heal, or it's getting larger, and it just doesn't look like a typical pimple, for example. You should always get it checked out, because I've looked at things and they've been what I thought would be benign, and they actually did come back as a skin cancer on the pathology. So really the only way to find out is to come in for an examination, and then we biopsy it if necessary.
I love that.
Yeah.
Coming for an examination. So let's lead right into that. I want to let folks know exactly where they can find you. You can give Dr. Hui a call, 760-610-2677. You can find her at 41990 Cook Street, Suite F1007 in Palm Desert. Or find her online, palmspringseyelidsurgery.com. Dr. Jennifer Hui, MD. Informative.
Thank
I
you.
learned something.
Very good.
You might have to see me in a little while. That's right. Appreciate you being here.
Thank you.
We'll be back with more show in just a break.